Hello everyone, welcome to CSBIAS Academy. This is Rahul. Today we are going to discuss about Dexamethasone, which is a current affairs topic, and the scope of the topic is prelims exam, which means it is basically factual in nature. Okay, let's get started. So why in news? Recently, Oxford scientists in a yet to be published paper, okay, they have found out results that dexamethasone it is found to be a promising treatment for COVID-19. As you know, COVID-19 is caused by SARS-CoV-2, which is a virus which is relatively new, and there is no vaccine or treatment for the disease. So they have been doing some experimental treatments, and they have held that dexamethasone it is found to be very effective in fight against COVID-19. So let's see what are the results. They have found there are basically two results, or rather three results that they have found in their study. One is when people are on ventilator, the second is when they are needing oxygen, and the third is when they don't need. So it's not mentioned here, but when they don't need any of these. Okay. So what they have found is when people are on ventilator, the mortality rate earlier was 40%. When they are using dexamethasone, it is actually reducing by a third. Now, if you take in numbers, okay, suppose people, for example, 100 people are on ventilator. Earlier, 40 people used to die. Now, right now, due to use of this steroid, what is happening is you can actually save one third of them, which means you can save 13 people. Right now, after use of dexamethasone, only 27 people will die who are on ventilator against earlier 40. Saving 13 people is still considered very progressive or uh, promising, because based upon their calculations and the number of cases in UK, they have found that if they have used dexamethasone on all the people who are on ventilator, they would have at least saved 5,000 people, which is a quite a big number. And since we are seeing that the cases are increasing worldwide, it can actually save thousands and lakhs of lives in future. Okay. And the other result that they have found is that when people are on oxygen support, it will actually reduce the number of uh, deaths by one fifth. Okay. When people are not on either ventilator or on oxygen support, then it is not found to produce any significant results. Let us see later why it is happening. Okay. And the treatment cost of treatment also, it is found to be very less. For example, in UK it is £5, which is cheaper for them. And in countries like India, because dexamethasone it is a steroid which has been in use since 1900 60s. Okay, it has been in use since then. uh, the costs or the scale has increased, the costs have reduced. So it is promising not only in terms of reducing mortality, it is also promising in the sense even the developing countries will be able to afford the treatment. Okay. Now let us look quite a bit about dexamethasone. Okay. Who discovered it? This is a fact which you should be knowing. It was discovered by Philip Showalter Hench. Okay. He has won a Nobel Prize, which is indirectly related to discovery of dexamethasone. He has won the Nobel Prize in 1950, but the drug was discovered in 1957. Okay. So what he has found is that rheumatoid arthritis. Okay. If you know, you should be familiar with this word arthritis. Arthritis is inflammation of knee or joints. Okay, which actually causes pain. In that, in rheumatoid arthritis, what happens is we have our own immunity, which is basically acting against antigens what happens is sometimes it actually starts acting on our own body cells. When it is acting on the body cells in the joints, it causes inflammation there and pain. At the same time, the walking and all, it becomes difficult later on. So what he has found is that this dexamethasone, it is able to reverse the earlier inflammation in the rheumatoid arthritis, which was a breakthrough then. Later on, based on his experiments and discovery, it is being used in other conditions also. It is used for a range of conditions. For example, rheumatoid arthritis, asthma. Asthma also, you should be knowing, asthma is a condition where there is a long-term inflammation of the respiratory system. Okay, and in treatment, how it is given to the patients when people are on intensive care. Okay, it is given intravenously, which is saline. Okay, and when people are not in that serious condition, it can also be taken in the form of tablet, which is very convenient. Okay, this is about dexamethasone and how it actually helps in COVID-19 patients. By now you should be knowing that why COVID-19 deaths are happening. It is basically because it is a new the COVID-19 SARS coronavirus 2, as we call SARS coronavirus 2, is a new virus, and we are yet to develop antibodies. So when the virus is entering our body is reacting similar to rheumatoid arthritis. Our body is reacting and it is causing inflammation or damage to the lung cells and the upper respiratory tract. Okay, then which is making lungs or the respiratory system weak, and it is causing breathlessness, and due to the lowering of oxygen saturation levels in the body, it is causing the mortality. Now since this dexamethasone, it is actually blunting inflammation. When the when the immune system is causing inflammation, it is actually blunting it or reducing it. So the inflammation is not happening, and there is a higher probability that patient will survive. Okay, so this is how. Earlier what was happening, COVID-19 is causing inflammation, and later on some of them are dying. Since here it is where the dexamethasone comes in, it is reducing the inflammation and the death rate. Okay, now one more doubt will come, like many people when it was announced that hydroxychloroquine was effective against COVID-19, many patients where they went to hospitals and they bought hydroxychloroquine. Okay, which was later on banned by the government. Okay, but right now also you may get doubt that if it is so effective and it is so cheap, can it be taken to prevent, like even if before COVID-19 infects you, whether it can be taken is some doubt, which is natural to everyone. So what the WHO or doctors are suggesting is that dexamethasone, what it does is it suppresses the immune response of the body. Okay, you know, as we have seen here, it is not actually working on the virus. Okay, it is actually working on the inflammation. Oh, so, but to come to this point, okay, you need some immune response. The virus will not be eliminated by treating the inflammation itself. There should be the immune response. If you take the COVID or the dexamethasone before the immune response, which actually can stop or can prevent your immune system uh, in acting against the virus. Okay, then your immune system is weak and it can actually aggravate the problem of virus. Okay, it is, as per the Oxford scientists, I have already told you, it is not effective in reducing mortality when you are having mild symptoms, because it is not acting against the virus, it is acting against the inflammation. Inflammation happens when like the when you are having severe symptoms, it means that you have inflammation. Only then it will work. It is not working if you are having mild symptoms. Okay, hence it is not advisable to take this steroid without medical advice. WHO guidelines also in general, it tells that steroids should not be taken earlier in treatment, as you have already known that first the immune response has to come in, and one of the side effects is inflammation because of the immune response. So in order to suppress that inflammation, okay, only then steroids should be taken, and they should not be taken earlier in the course. Okay, so don't go to don't go to the medical store tomorrow and ask for the dexamethasone. Okay, so how it is better than remdesivir? Okay, remdesivir is also a drug that has been in use recently, because ICMR has recently allowed remdesivir to be used for experimental treatment in India, and some of the hospitals have already started it. Okay, how it is different? Uh, remdesivir, it remdesivir, it fights the virus. Okay, if we go back to the same diagram, okay, here remedesivir works, okay, on the virus itself. Okay, and here dexamethasone works. Okay, remedesivir works directly on the virus. Like if you know the functioning of virus, it needs to attach to body cells and go into it and multiply in order to uh, in order to uh, cause the disease or reproduce. It needs to hijack a human cell. In order to do that, it has to attach to the human cells. Okay, remedesivir, it prevents the attachment. That means it prevents the disease itself. Okay, but dexamethasone, it acts on the inflammation. Okay, now earlier remdesivir, it was used extensively. It is, since it is an antiviral treatment, this is like it is not only used in Ebola, it is also used for other diseases, but it was extensively used in Ebola. If you know it, it was a disease that exploded in West Africa a few years ago. Since Ebola also didn't have any vaccine or medicine, okay, then they have used this for treatment of Ebola. Okay, remdesivir, it is known to reduce the symptoms from 15 days to 11 days. Okay, if you know the incubation period of uh, COVID-19, it is generally like 14 to 21 days. Some of the patients, they're in hospital for like 1 month, more than it also. But in general, it is 15 days. Remdesivir is known to reduce this to 11 days, but it is uh, it is not known for sure if it is actually reducing mortality. It is reducing the number of days the symptoms are showing, but there is no conclusive evidence that it is reducing the mortality. Okay, and since remdesivir, it is a new drug and it has limited supplies. Even in India also, very few hospitals are actually treating people with remdesivir recently. Okay, it is not widely available and it is a bit costly also. Compared to it, dexamethasone, it is an old steroid and widely available, and it is cheaper, and it is seen to be a better option. Okay, and as I've told you, this is a prelims topic. You should also be knowing some of the other medicines or drugs that have been in use in recent times. Okay, one of it is hydroxychloroquine, which is mainly used for malaria treatment. Okay, but it is also being used to treatment of rheumatoid arthritis and lupus. Okay, this is one fact which you should know. And remdesivir, which we have already discussed, and ritonavir and lopanavir, these are also in use, because a combination of these drugs are also being used experimentally in order to treat COVID-19 patients. Okay, ritonavir and lopanavir, they are used to halt the progress of HIV. Okay, So let's quickly summarize what we have discussed today. Dexamethasone, Oxford scientists have found that it is reducing the mortality rate by up to one third in patients on ventilators and one fifth in patients who are on oxygen support, and it is very cheap, costing less than $1 uh, in the in India or in developing countries like India. Okay, and it was discovered. Dexamethasone was discovered by Philip Showalter Hench. Okay, it is used for other treatment of other diseases also like rheumatoid arthritis. Okay, and it can be injected into the body intravenously, and as well as if the symptoms are not that severe, in tablet form also. And it helps because it reduces or blunts the inflammation. It helps the patients because it blunts the inflammation in body. Okay, and it should not be used without prescription, as you have told, because it is acting against inflammation and not against the virus. Okay, why it is better than remdesivir is because of its cheaper nature, because it is reducing the mortality rate. Okay, and wide availability. And the other things are hydroxychloroquine. These also can be asked as statements. Hydroxychloroquine is being used for malarial treatment as well as rheumatoid arthritis, lupus, etc. Remedesivir, it is used for COVID-19 treatment. At the same time, earlier it was used for Ebola treatment. And ritonavir and lopanavir, they are basically HIV drugs which are being experimentally used for COVID-19 treatment. Okay, that's it for today, and thank you.